Welcome to China Today. I'm Li from Guangxi Normal University. In this section, I'm going to introduce to you health care system in China. This lecture covers the following three parts: three types of healthcare institutions, universal health coverage, online healthcare finding its way. Three types of healthcare institutions. China has established a healthcare system consisting of hospitals, local health institutions, and specialized public health institutions. Hospitals in China include general hospitals, traditional Chinese medicine hospitals, integrated TCM Western medicine hospitals, ethnic minority hospitals, and various specialized hospitals. Hospitals in China can also be divided into public and private hospitals. Local healthcare institutions mainly consist of community centers, township clinics, and village clinics. Their main responsibilities are to provide basic public services. Specialized public health institutions include disease prevention and control centers, emergency centers, maternity and child health care institutions, blood collection and supply institutions, and health supervision agencies. They provide various professional health services such as disease prevention and control, first aid, maternity and child health care, and blood collection and supply services. Universal Health Coverage, UHC. Universal Health Coverage, UHC, is an ambitious goal wherein all individuals and communities can access quality health services without suffering financial hardship. In order to solve the problems of seeing a doctor is hard, seeing a doctor is expensive, the Chinese central government launched an ambitious plan of healthcare system reform in April 2009, with the goals of providing universal coverage of essential health services for all Chinese citizens by 2020. The government has since quadrupled its funding for health. China issued the 13th five-year plan for medical reform in December 2016, which emphasizes that China needs to take more systematic approaches to proceed with the ongoing medical reform. In October 2016, President Xi Jinping announced the Health China Blueprint HC 2030, a bold declaration that made public health a prediction for all future economic and social development. The HC 2030 blueprint, released in Beijing by the Chinese government, includes 29 chapters covering public health services, environment management, the Chinese medical industry, together with food and drug safety. The HC 2030 blueprint has been established as a national strategy and sets a goal of enabling everyone to be involved in health, share health, and be responsible for health. There are 5 specific goals to improve the level of health nationwide. Control major risk factors, increase the capacity of health service. Enlarge the scale of the health industry and perfect the health service system. The blueprint is based on 4 core principles, that is, health priority, reform and innovation, scientific development, and justice and equity. The framework of HC 2030 is shown in the figure. Online healthcare finding its way. China's health authority is urging hospitals in the country to integrate internet use into their medical practices. The central government vows to uphold the Internet plus health concept in the medical reform. This telemedicine system allows patients and doctors from underdeveloped areas to meet the country's best doctors, who are often based in major cities such as Beijing. The Connected Health program has been in place for years. Now, the central government wants it to be developed and extended further. On July 31st, 2019, the National Healthcare Security Administration said the first draft of the pricing details of Internet-based medical services was completed, and such services will henceforth be covered by the country's medical insurance system. Currently, most of China's public hospitals have a presence on online healthcare platforms, and patients can consult with their doctors through the online platform. Doctors' basic information, including their specialization, professional qualifications, experience details, hospital, where they are available for consultation, can be accessed online. Online consulting fee normally ranges from 10 yuan to 500 yuan. The government of China has decided to give online healthcare a boost amid its fight against the COVID-19 outbreak. Internet-based medical services and subsequent treatments will be covered, according to the new guidelines for the country's medical insurance system issued by the national health authorities at the end of February 2020. Experts believe that access to health insurance system through online payments will certainly give China's online healthcare another push. Let's see how online health services work by watching a video.
Every day from his office in Wuhan, Professor Cao Wei provides consultations online through WeDoctor. The platform has been recently included in the city's medical insurance system.
Judging by your symptoms, you are in stable condition. All you need is to take the same dosage of medicine as you did. In case anything's up, keep in touch with me online.
Since the start of the outbreak, hundreds of millions of Chinese stuck at home due to quarantine measures are turning to online consultations. Monthly consultations of JD Health, run by the largest retailer in China, have grown tenfold since the outbreak to 2 million. Registered users of Dingxiang Doctor, a medical services app, have also more than doubled. Professor Cao Wei says it's easier to find specialists online now, and the shift helps reduce risks of infection.
The patients can send detailed information of their medical records online. We will diagnose the illness based on previous checkups and medical history and then propose treatment plans. It saves the patients trouble lining up at hospitals, which could lead to cross-infections.
In summary, China has established a healthcare system consisting hospitals, local health institutions, and specialized public health institutions. The government is making efforts to provide all citizens with equal access to basic healthcare. And Internet Plus medical service is developing as well. Dear students, this lecture comes to an end now. See you next time.